Today we're demonstrating PA oblique RAO stomach. Patient is prone. We're placing a 10 by 12 lengthwise in the bucky with a left marker in the lower left corner. Central ray is perpendicular. We're going to rotate our patient approximately 45 degrees. Merrill says 40 to 70. It varies with patients, but for demonstration purposes, we're using about 45. Use center at L1, L2, which is the anterior curve of the ribs, or it can also be approximately 1 to 2 inches above the lower rib margin. Use center between the spine and the left lateral surface of the patient. We are at 40 inches. We have lead shielding on our patient. If you have a hypersphenic patient, they require more rotation. We are going to suspend breathing at the end of expiration. In this view, we can see the anatomy of interest is the duodenal bulb, the loop, and stomach. There will be air in the fundus and barium in the body and pylorus.
Okay, go ahead.
Now we're going to move on to the right lateral stomach. Our patient will roll into a lateral position on the right side with the knees flexed.
Go ahead and point to your
We
anterior
still will have a 10 by
cervix.
12 image receptor in the bucky. We want to make sure the patient is not rotated, that they are in a true lateral position. And we're going to center once again at L1, L2, the anterior curve of the ribs, or 1 to 2 inches above the lower rib margin. Central ray is perpendicular between the mid-coronal plane and the anterior surface is where we center. We're going to collimate to the image receptor, and we want a right marker in the lower corner now because our patient's on the right side. We have lead shielding, and we're going to suspend breathing at the end of expiration. This is done for anterior and posterior parts of the stomach, the pyloric canal, and the duodenal bulb.